morning, everybody. I wanted to spend a little bit of time talking about vaccine preparation and what we need to learn about the vaccines that we're giving to our dogs and what we can do to support and protect the body as much as possible with any administration of vaccines. I am not here to advise you not to give your dog vaccinations. That's a decision between you and your vet, more importantly, you, which is why I want to give you some information that perhaps educates you and informs you on things that you might not know, and give you an ability to discuss this with your veterinarian in ways that maybe you haven't before. I'll take this moment to remind you that I am not a veterinarian, so please understand that the information that I'm giving you here is educational only. It is not intended to give you a prescription, medical guidance, or any sort of treatment or cure for anything. You're encouraged to do your own validation of the information that I'm sharing with you and make your own decisions based on your research and your findings of this information. So we're going to walk through each of the vaccines, each of the common vaccines, and what you need to know about those. We'll talk about vaccine scheduling and reasons that they may need to be administered apart from others. And then we'll also talk about information that you can implement that's going to help your dog and perhaps even yourself at some point deal with vaccines that have entered the body in a more supportive way, right? So the body needs to be able to protect itself when we administer these things, and there are things that we can do that help the liver, the immune system, and the overall health of our animal just be as strong as possible when these things need to take place, okay? So we'll start by talking just very briefly about why this is important, and then we're going to dive into each one. But I'll make reference here to a book that was written in 1884 by a guy named James Compton Burnett, and it's called The Vaccinosis and Its Cure by Thuja, Thuja. So this book is extremely old. I actually have a copy of it on Kindle, and I've read it. It's very fascinating, and it talks about people who back in 1884 had all sorts of health conditions, many of which were unexplained. And I think that's the key to a lot of this, right? Is we all, as pet parents, are dealing with a lot of issues that can be things related to allergies, autoimmune disorders, behavioral issues, gut health issues, and some serious diseases, whether that's seizures, well, not that autoimmune issues aren't, but seizures, cancers, and even death in some cases, right? So this book is really written about those same types of things as it related to people in 1884, and how this physician used a homeopathic remedy called Thuja to help these people recover, to help get them sort of back to normal, or at least significantly improved. So if you're really interested in this sort of thing, that's a kind of fascinating book to take a look at. As it relates to us, we all have dogs that have a requirement in many cases to receive vaccines. The rabies vaccine is law and says that we have to have it every 3 years. Parvo distemper by definition is a requirement because that disease is deadly, both of them potentially deadly and preventable, right? The question is, do we need it to be repeated? Do we really need it to be repeated in the future? And the answer is probably not. There's a test that can be given called titers that test the antibodies of your dog, and is he or she manufacturing them today that is offering protection against these other diseases. And if you're connecting the dots, friends, this is a topic that it's prevalent not only for our pets, but it's in our world today for our own health and discussion. So keep in mind that there will be a lot of similarities in things that we need to do for our pets and perhaps even for ourselves. So there are veterinarians and studies that show once vaccinated for parvo distemper or even rabies, that it is unlikely that our dogs will ever need to be vaccinated again, that they will produce antibodies that protect them for the rest of their lives. For some, that's going to not be true, which is why the titers test is important, so that you actually know. But even when we look at like the rabies vaccine itself, it's only 88% effective, meaning 12% of the dogs that have actually received the vaccine may not actually be protected against rabies. Okay, so these are important little things to know and understand about this. We'll drill into each of them further. Dr. Jean Dodds, among many other holistic, integrative, natural veterinary practitioners, they've come up with guidance and scheduling guidance that helps us think about how we are administering vaccines when we need to. And so we're going to talk about this, but I understand that this outline is really in an ideal world. When we get a puppy and we raise a puppy and we keep that puppy into adulthood. The tricky part of what I'm about to share with you comes when we get a rescue dog who may not come with vaccine records or history, right? And we wind up vaccinating them again, which could in fact be an over-vaccination. And that could be where we start to see some of our biggest concerns and our biggest impacts to the health and well-being of those pets. So Dr. Dodds tells us that we should basically not give any vaccine together with any other vaccine, meaning parvo distemper should not be administered at the same time we do rabies. They should not be done in conjunction with any other medical procedure or while under great stress. Now, going to the vet is often pretty stressful for dogs in the first place, right? Puppies may not have realized that yet, but some of our older dogs are certainly going to be stressed at being at the vet. So we need to address the stress that comes with that. But the point here really is, if your dog's body is unwell and under stress and perhaps going through some surgical procedure or injury or other factors along those lines, that is not the time that is ideal to give a vaccine, because the body under stress is struggling with its immunity at that time, and it could make things more complicated. So the schedule outlines at parvo distemper being given between ages 9 and 10 weeks. At 14 to 15 weeks, so about a month later, right, a little more than a month later, that will need to be boosted. And then when they hit 18 weeks of age, so again, about another month, to give the parvovirus only. They don't need the next distemper. They don't need that. The problem, though, is in most of our cases, they are a combination administration, right? So just keep this in mind. When you're doing this, you want to look for what they call a modified live virus. So this is one of those questions you can ask your vet. Is this a modified live virus? When we get to 20 weeks or older, if your state laws support that, that's where we want to do the rabies shot. It should be delivered at least 3 to 4 weeks outside of any other vaccine. So if you've been on this schedule of parvo distemper and at week 18 you gave a parvo vaccine, right, then you need to wait at least 3 to 4 more weeks before the rabies vaccine is administered. I know that our rescue space is not following that. That's not what they do in probably most cases. And I understand why. I understand the difficulties that they have and the expenses that they have and so on, not to mention the volume. But if we're really trying to do things as idealistic as possible, this is the guidance. It's important for you to ask for a thimerosal-free vaccine. I have had people argue with me up one side and down the other that there is no longer thimerosal or mercury in vaccines. And that's just not the case. You have to know for sure. You have to ask. And unless your vet is asking for them when they purchase them, it may not even be labeled properly. It may not be something that they even pay attention to, and it won't stand out, is what I'm trying to say. And they need to know, they need to ask, it needs to be requested that way. So they get their first rabies somewhere around 5 or 6 months. At 1 year later, they are going to get their parvo. I'm sorry, I'm telling you this wrong. This is why I need to edit this stuff. I can go back and edit. So at 5 or 6 months, they get their rabies. At 1 year old, they're looking for the optional booster to parvo distemper. You need to ask for a titer at that time. That's the first place you should check to see if your dog actually needs it. And then 1 year after the first vaccine for rabies, they get another. And technically, y'all, it's the same vaccine. They're not different. Everybody thinks that there's a 3-year vaccine and a 1-year vaccine. There are not. It's the same. And the vaccine is the same dosage no matter the size of your animal. So a little tiny Yorkie is going to get the same dosage as a Great Dane. There's not a difference. It's the schedule that. Your vets also receive a rabies vaccine themselves, and then they titer themselves year after year to determine if it's necessary to be revaccinated. And in most cases, it's not. And the same is true for our animals, but the law does not match that. So this is where it's really important for you to understand this, to know what is going on, and to participate, if possible, in the efforts in your state that are trying to get some of these laws changed and modified so that we will honor the titer test for rabies for our dogs. So there are no laws against parvo distemper, bordetella, that kind of stuff. There is a law about the rabies, and that's what many people are trying to get changed to validate that the titer is enough, that the titer says, yes, the dog is producing antibodies, and that we don't have to revaccinate them. So titers becomes really, really important. Your vet may charge you an exorbitant amount of money for a titer, and it doesn't have to cost an arm and a leg. There are programs through Dr. Jean Dodds, through Dr. John Robb, through others where you can get the blood draw and send it into their labs for an affordable fee to have your titer results come back to you. It's unclear to me why vets are charging these astronomical rates for titering. I just don't understand the pricing differentials that exist there. So we also need to look at our pets and say, should this particular individual animal receive the vaccine under any circumstance? And so this may be for our senior dogs, our dogs that are unwell, our dogs that are already presenting with autoimmune disorders or already presenting with seizures, already presenting with cancer. What will another vaccine do to their health? I can't answer that, right? I can't give you a veterinary discussion about that, but I can tell you that we know their bodies are already compromised. We know that their immune systems are compromised. They're unhealthy to begin with. And then we go and we flood their body with things that are going to further compromise their immune system, further burden the liver and its ability to manage this toxic waste. And you got to question, is it right? Is it okay to do that? Do I want to do that? And especially at times where the vaccines are optional, should I do that? In the situation of the law dictating that there's a requirement to do it, some people are playing the odds. Some people are saying, I am not going to do it. I won't do it. You can't make me do it. And then, you know, there are other situations where you're like, I'm scared to death, but I got to do it, right? And I kind of fall into that situation currently. Luckily, Poppy's healthy, but because of my job and because of having her out with me so often in working sessions or even just out to lunch, and because of her breed, I feel like if there were ever an incident, even if it weren't her fault, but even if she were just injured in some way or somebody made a false accusation, that because of her breed, she would of course be to blame. And if I'm standing there with my little titer document that proves she doesn't need another rabies vaccine, but it, you know, it proves that she's producing antibodies, that nobody's going to honor that. They'll honor the fact that she's got a rabies tag, a rabies number, certificate, but they won't honor the titers, and that could mean a whole lot of other complications in keeping Poppy alive in some cases. And so it's an internal angst that I struggle with all the time. She got her last rabies vaccine, and she'll probably get the next one and continue to do so as long as we are doing this job. But my weenie dogs are not. I haven't vaccinated them, and they get challenged by it if I go to a new vet, which is why I continue with my sort of wellness, and I'm driving an hour to get there when I need to. But at 17 years old, I'm not going to give Howie another rabies vaccine. I'm just not. He's healthy, and I want to keep it that way. I don't want to do anything that burdens his little body even further. So there are waivers that you can get from your veterinarian, and your vet has to support that, but it has to be based on really serious health concerns. Some vets will not see a seizure or even a cancer as a reason not to vaccinate your dog again. They just don't. And so this becomes a really important discussion to have with them about why and how and what your desires are, especially for those optional vaccinations. So then, I mentioned the rescue dogs and the fact that they land in shelters. We don't know their history. We don't know if they were vaccinated. So as soon as they land in the shelter or in a rescue group, guess what happens? They get vaccinated. So there's a strong possibility that many dogs have received basically double doses of stuff in a very short period of time. And we know that they are tending to give everything all at once. You go in for an appointment, get everything done, and you're out of there. We could, in fact, be truly over-vaccinating our pets and putting a serious compromise on their body. They may look healthy to you, right? But we could see signs of vaccinosis happen months later, a year later. And if you follow the book that I was telling you about, that talks about vaccinosis and using thuya as a remedy, it speaks to that same type of behavior for how the body responds and what's happening. And basically, in some cases, it's like there's a documentary that was done a couple of years ago called The Truth About Cancer. And one of the things that they shared was from Rodney Habib, who does a lot of research on cancer and the health of animals. One of the things they talked about was how in the body we have mitochondria, which, you know, is the a part of the cells of our body, and it is protective, and it takes a beating, it takes a burden. So we put a flea and tick topical on, we put a vaccine on, we have an environmental chemical in the yard, we have cleaning products in the house, we have whatever, right? And the mitochondria is taking that burden and at some point has a failure. It is compromised. It can't fight back anymore. And that's going to be a variable for every individual. But at some point, the mitochondria may basically fail and become compromised. And then we start to see a dog become very unhealthy. And how long does that take? Nobody knows. Nobody can predict that. Some dogs will go their whole lives and never have an issue. And others will go to some point in time and then have a big failure, have a big disease expose itself. This is where I get really frustrated with people who say, I've done X for years and never had a problem. We've given my dog blah, blah, blah for years and never have a problem. I've never had a problem. I've never had a problem. And I'm thinking, yet, we lucky you, but we just don't know that you won't. So what we do know is that if we help support the body, right, we help support the body with supporting the liver, supporting the immune system, supporting antioxidant health, which supports the cells and the free radicals and all those things attacking the cells of the body, then we've got a better fighting chance. We know this to be true. So why are we not doing those things and mitigating or minimizing as many risks as we can when they are optional, when there are alternatives, and when there are ways to do it successfully with natural solutions? Why do we keep at this just because we always have? That's a question you need to be asking yourself. Just because I always have, or I've always been told that this was what I was supposed to do, am I? Is there something else I need to know or need to do? Yeah, there is. So we have many, I get calls every day that are, the dog has gut health issues, allergy issues, autoimmune issues, anxiety, aggression, liver issues, kidney issues, cancer, you name it. Where is it coming from? I don't know that we will always know, but I know that if you read and you study and you look at documentaries like The Truth About Cancer and you listen to these holistic veterinarians and practitioners, the downfall to what's happening to the health and the immune system and the body's ability to heal itself and keep itself healthy is because of all the chemical stuff that we are exposing it to, that we are putting in it and on it and through it, right? We need to start making those adjustments wherever we can. So I'll go through each of the vaccines here in a second, but just looking at my notes, one thing to keep in mind is that your dog's body's immune system will be weaker after the administrations of vaccines for a long period of time. So vaccines going in, flea and tick topicals going on, they actually reduce your dog's ability to protect itself for who knows how long after that. But this is why we want to really focus on the immune system before and after, and doing some detox work after. And I'll share that with you as we get to the end of this. So I'm going to start with rabies. There's something called the rabies miasm, and it relates to vaccinosis and the things that we can see that the body is basically acting as if it has a symptom associated with rabies. That's not to say your dog has rabies, but when we give these vaccines, we can start to see issues that we've never seen before be present, and they can be associated and similar to symptoms of actual rabies. And this is how homeopathy works. So remember, we're talking about the book Vaccinosis and its Cure by Thuya. Thuya is a homeopathic remedy, and homeopathy is based on like supports like, meaning you use an extremely diluted amount of the disease, if you will, to treat the disease. And that's the simplified version of it. It's far more complicated than that, but that's the gist of it. And the amount of dilution and this thing they call succussion, which is how they make it, is exponentially more than you and I can do in our kitchens. This takes lab work and all sorts of stuff to create. So this is not something that you and I can actually do ourselves, but these remedies can help us. So general theory is anytime we are given a vaccine of any kind, we need to support the immune system. We need to use a remedy like Thuya, and we need to then on the backside of administration really focus on things like antioxidants, detoxification, liver support, helping the body detox, and I use essential oils to do that. And I have a protocol that I've written out for all of this that can be something you and I can discuss. It's individual. I mean, there's a basis to it, but there's also, it depends on the uniqueness of your animal, the particular issues going on with your animal, his weight, his size, all that kind of stuff comes into play as to what we need to do. But let me just give you a couple of things to think about in terms of what you might see in your pet as something described as a clinical condition after vaccination. And this is the rabies vaccine. Restlessness, suspicion of others, unfriendly to other dogs, vicious to other animals, aggression, mistrust of strangers, especially people in uniforms, changes to behavior in aloofness, becoming less affectionate, becoming clingy, fear of being left alone, following, I call these Velcro dogs, needs constant physical contact, tendency to escape confinement and to roam. Does this sound like separation anxiety to you, or dogs that are jumping the fence? Self-mutilation, tail chewing, their voice or their bark tone may change. having a poor appetite, becoming finicky, loss of sight, cataract formation, dry eye, become where they eat, I've just scrolled into the wrong space, eating wood, stones, sticks, things that they shouldn't be eating, destructive behavior, irregular heart rate, perhaps even cardiovascular issues, and reverse sneezing attacks. Those are just a few of the common, and interestingly enough, each of those has a sister component in a rabies symptom. For a dog that actually has rabies, they can have similar, far more extreme symptoms, but they can be present. And so what we have to look at is, did this happen after a vaccine? And that becomes a tricky question too, right? But the point is, if you've had a dog that for 3-4 years was awesome and then got a vaccine, and then the next year, for some unexplained, I can't put my finger, I don't know why this is happening. I have no explanation for this. My dog has some of these symptoms. It could very well be vaccinosis. It could very well be a function of that. Can you do something about it then? Maybe. We can certainly look at going back to a Thuya remedy. We can look at listen as another homeopathic remedy. We can look at doing a body's detox. We can't get the vaccine out, but we can perhaps support the body and help some of that cellular recovery or that emotional recovery, or those things that we need to do to try and improve its immunity and its health as much as we can, to try and reduce the intensity of some of those issues. It's certainly worth a try. When we look at distemper, there's a vaccinosis association with that as well. What we often see, let's see, canine distemper. When we have canine distemper, we often see watery discharge from the eyes, vomiting, diarrhea, watery feces, severe diarrhea, spasms, epilepsy, seizures, paralysis, eruptions around the mouth, swelling of the feet, pneumonia, pustules on the abdomen and the thighs, or a dog that is very emaciated. Okay, those are the symptoms of a dog that has distemper. Some of the vaccinosis conditions might look like drippy noses, conjunctivitis, chronic chronic gastritis, hepatitis, pancreatitis, and appetite disorders, epilepsy, rear leg paralysis, spondylitis, lip fold dermatitis, allergic eruptions on their face, a habit of licking their feet, especially between their toes, with eruptions, chronic skin eruptions around their abdomen and inner thighs, and just a failure to thrive with nutrition. Right? So if your dog looks like it has some of the similar symptoms, could it be related to vaccinosis from the original vaccine? Maybe. It's certainly worth, again, looking into nutrition, immunity, detoxification, and homeopathic remedies, essential oil type things, where we can, to try and support the body and optimize it as much as possible. Okay. So let's now look at some of the other optional vaccines. We'll start with kennel cough, being Bordetella. What's wrong, Howie? Bordetella is a vaccine that many of you are going to be required to have by your doggy daycare or your veterinarian if your dog is boarded or going into any sort of surgical procedure or whatnot that requires them to be kenneled for a period of time in their facilities. I wouldn't give, if I had to do it, I wouldn't give it at the same time of any medical procedure. I would do it somewhere a couple weeks prior, because first of all, it's going to take a little while to get into the system and start to work. But here's the catcher, right? It's not going to protect against everything. It's only, I'm sorry, I've got my notes out of order here. I had a note that talked about how many strains there were. Anyway, I'll come back to it. I'll find it. But basically, Bordetella is a virus, much like the common cold is to all of us. There it is. There are about 40 possible causes of what we call kennel cough. The vaccine does not cover all of them. It will only cover a few. So what's going to protect your dog most from catching kennel cough, common doggy cold kind of thing? His immune system, his ability to fight that off, is going to primarily come from his immune system. And what happens when we give them the vaccine itself is they're actually going to be contagious just from having received the vaccine. They will be contagious to others for a couple of weeks, at least 7 days, because that vaccine is going to shed out of their body, shed off of them, and as a live vaccine, they can actually give other animals kennel cough, even if they were just vaccinated for it. So important to understand that. There's a veterinarian named Dr. Ronald Schultz that states many animals receive kennel cough vaccines that include Bordetella and CPI and or CAV2 every 6 to 9 months without evidence that this frequency of vaccination is necessary or beneficial. In contrast, other dogs are never vaccinated for kennel cough and the disease is never seen. Interesting. He also goes on to describe that this is what we would call a mild or moderate self-limiting disease, meaning much like our cold, the canine cold as he calls it, would be something that they would have and would just minor supportive respiratory care, which we can do with essential oils and homeopathic remedy. And guess what? Good nutrition. The dog's going to recover from it. Now, I get it. As a kennel owner, nobody wants that outbreak in their environment, because guess who's going to get blamed? The kennel, right? Somebody's going to be like, oh, it's not clean. Oh my God, you let an unhealthy dog in here. Oh my God. And we all know what comes after the oh my Gods from pet parents and people who feel like we have made their dog unhealthy, right? So I get why people want to protect their environments from that. And so, but the problem is we're not really protecting much. We're not really preventing it from happening. Good cleaning, good nutrition, good health, all that kind of stuff is certainly beneficial to that. But you can't fully protect from it. I had a situation a few years ago when I was doing board and train where a dog came to me for training after having spent 2 weeks in a kennel while his family was on vacation. So he was boarded. They were on vacation. He was boarded for a 2-week period. He came to me, and when he got there, he was dripping green snot everywhere. And I called his people, and I'm like, okay. And so we didn't know if there was kennel cough in the kennel building where he had been boarded. I had about 12 other dogs in my facility. And of course, nobody wants to spread that around. I quarantined him, so to speak, meaning I moved him in my house instead of out of the kennel building, and started with parental permission, a protocol of essential oils and homeopathic remedy and that sort of thing. Got it knocked out of him almost overnight, and started diffusing essential oils in my kennel building and doing a little bit of supportive for every other dog that was in the kennel building. And we never had a problem. We never had a breakout of anything that was worrisome. So just be aware that kennel cough, very similar to the common cold, very easy to recover from, very easy to support while your dog has it, and is actually probably more preventable than we think with good nutrition and good respiratory support in general. Okay. The Lyme vaccine, we panic a lot about Lyme. And I understand why. It can cause a whole lot of health issues. It causes health issues for people, causes health issues for our pets. But there are really strong antibiotics, if we have to go that route, that can help treat Lyme disease. We also know that there are homeopathic remedies and essential oils that can help support, I can't tell you that it treats, but can help support the body that may have been exposed to Lyme or have Lyme disease type issues, tick-borne illness issues. And so that's one of the things that we need to understand is with with tick bites, Lyme is not the only tick-borne illness that can be presented, right? When we use a flea and tick topical or a flea and tick oral that we're trying to prevent Lyme disease or Ehrlichia or whatever these other illnesses are, what has to happen? The dog has to get bitten by a tick. So are the preventatives working? Are your flea and tick topicals working? If they are, your dog's not going to get bit by a tick. But that's not how most oral and topical or collar-based flea and tick products work. They work that when the dog is bitten by a tick, tick dies, dog got bit by a tick. So the best option is to keep ticks off your dog. And we can do that with good nutrition, truly good nutrition, essential oils, and we can even use natural products in our yards to keep them out. If you're going out, you're a hiker and you're in a highly wooded area and you feel like you need to do that, essential oils can be sprayed on your dog and keep ticks away from them the whole time you're out there. Keeping them off is a better option than getting bit by a tick and having the tick die. It's just a better option, right? There are homeopathic remedies that should, for some reason, your dog be bitten by a tick, we can use the homeopathic like supports we can help deal with that. We can offer detox support to the dog's body and help them recover as much as possible. Same is true for people. How about lepto? Only 4 of about 200 strains of lepto are actually covered by the vaccine. That's not very good odds, right? Not very good odds. The vaccine is also only protective for a few months of the year, meaning you get a vaccine and it does not last you a full year. It does not last until the next scheduled time to deliver. So you think, well, why isn't there a next scheduled time? How many of you are going to go back for a 9-month vaccine that's not likely to work in the first place? Or a 7-month vaccine? Not many of you. All right. The vaccine has some serious potential side effects that include lameness, anaphylaxis, kidney failure, cancer, death. Did you know that lepto can be contracted by you as well? Right? So in some ways, they're saying use your pet to help you not be exposed to leptospirosis. The reason humans are not given the vaccine is not because it's a canine vaccine, but because the vaccine is too dangerous to be used in the human population. Its side effects are an increase of autoimmune diseases. In humans, probably in our pets as well. Okay, so lepto is also treatable. Is it potentially deadly? Yes. Is your dog drinking out of mud puddles that have been peed in by squirrels and deer and wildlife? Probably not, right? Depends on where you live. Depends on whether you're a hiker or not. So you have to weigh the risk with your exposure to something like that. But it's treatable even if your dog contracted it. So how would you know? If you're as much of a dog mama hawk like I am, if my dog is off in any way, I'm questioning that. I'm like, he's not himself. That's not normal. And I'm certainly not going to let it go on very long before I'm taking action to be seen by the vet if necessary. So my first course of action in any off behavior from my animal is, what do I think it is, right? Lepto might not be the first thing that comes to your mind, but something's off about him. Is his digestive system upset? Is he in pain? Is it joint related? You know, what is it? What can we ascertain from this? And I start dog mama remedies that are essential oils and homeopathy and kind of get the ball rolling on those things while I keep an eye on it. And within 24 to 48 hours, I'm making an assessment of whether we need to be at the vet or not, right? And from there, we can take it. So again, it's treatable. So no, my dogs will not get the lepto vaccine either. They won't get Lyme. They won't get lepto. They're not getting any more parvo distempers as long as Titers comes back and says they don't need it. The weenies are not getting rabies with Titers. Titers say they don't need it. They're 17 years old. I'm not going to risk it. Poppy is. The one we haven't talked about yet is the Pro Heart vaccine, the heartworm preventatives that are injectables now they're 6 months at a time. There used to be a Pro Heart 12, and I honestly don't know at the moment if there's a Pro Heart 12 or not. My advice to you, I can't prescribe anything, but my advice to you is say no. We know that if your dog got into a pack of heartworm preventative and ate the whole pack, he would experience a toxicity. Ivermectin toxicity is what he would have. It's dangerous. It's potentially deadly. So I don't get why we would inject a vaccine like that that's supposed to support the heart, that's supposed to last 6 months at a time. I mean, I don't get it. It's not the same medication. I get that. But in theory, it just doesn't make any sense to me. If I can support my animal against heartworms, and I believe that we should, right? This is one area that you have to take care of your pet. Just like parvo distemper is not optional until you know they're producing antibodies, right? Heartworms must be prevented every single year in some way. We can do that with a monthly dosage of ivermectin purchased from your veterinarian in the form of HeartGuard. Don't use these all-in-ones because remember, there are too many chemicals flooding in the body at the same time. Don't let that happen. Keep their things separate. If you must do flea and tick and HeartGuard, separate them by 2 weeks minimum apart from each other, right? A minimum 2 weeks apart from each other. Don't deliver them the same day. So that means you can't use these all-in-ones. even when you think about the collars, like, and I'm not going to name the brand, but when you think about the collars that are supposed to keep fleas and ticks off your pet, your dog's wearing something on its neck for 8 months that is not keeping the fleas and ticks away. It's going into his bloodstream so that when the fleas and ticks bite him, they die. That is a neurotoxin living in your dog's body at all times. We got to stop. Right? We just got to stop. So where was I going with this? Heart Guard is a better option than any of these combo deals with flea, tick, and heartworm and other worming agents in these combination products. Separate them apart, even if it costs you a little extra money. Separate them apart and don't administer them the same day. Okay? Ideally, so this is where, again, I'm not a vet. I can't advise you to do this. I can only tell you what I do. I use ivermectin, but they don't get it every month. We have a modified schedule that I am comfortable with based on the life cycle of how heartworms work in your dog's body and the bite from the mosquito and the microfilaria, blah, 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 and how all that comes together. I use a modified schedule for only a portion of the year. And if you want to talk about what that is, as a client, when you're a client, we can do that. But I'm not going to share those significant details here. I will tell you that it is, again, it's not monthly and it's not every full year, right? So we take the winter months off. And that's going to vary. That's going to vary for some of you based on how long your winters are, right? But we started with this on the heart injection, the heartworm preventative injection. It was actually recalled off the market years ago when it first came about, reworked, rebranded, and then they've been using it again. But there are safer alternatives than a big dosage at one time that's designed to last for 6 months. There are smaller dosages that are going to be less burdensome all at one time. And this is kind of what triggered me to even do this presentation, is because a friend of mine messaged me over the weekend and said, we gave our dog the heartworm preventative injection and now he's acting really lethargic. What do I do? Right? Don't do that, right? We can't get that shot out of his body now. We can't. We can do some other things that support him. But he probably never should have had it in the first place because he's an unwell little guy. And he has a lot of issues with pancreatitis. He has some digestive issues. He's kind of just not a healthy, there are things that make him a little fragile, we'll put it that way, right? And so would I have used a dosage like that with that dog? Never, never. I would be looking at how can I do it as minimally as possible, little by little, and still keep him protected. But that's the way I want you to approach all of this, is how can you do as little as possible, as much as possible naturally, and when you do have to do something like the rabies vaccine, what else can you do to help support them? And so that goes into where we're headed with the protocol. I knew this was going to run a little long, but that's okay. So for a minimum of 2 to 3 weeks prior to the vaccine, any vaccine, I'm really going to be focusing on my dog's nutrition. Now, my dogs eat a raw diet, so they get good nutrition every day anyway, but nutrition is the key to good immunity. So if you're feeding a kibble and you are not using a vitamin mineral supplement, a good vitamin mineral supplement, I recommend Endurance from Volhard, which not only gets you a great vitamin mineral supplement, it gets you access to me as a client. That's one way to think about this, right? But that's going to help boost your dog's immunity in one way, just by giving them better nutrition. If you can't switch to raw, even for a home cooked period, endurance is a supplement that you need every day. Probiotic, digestive enzyme, start boosting their immunity. Start getting that gut health better balanced. Why do we need to do this so early? Because guess what? When you start introducing good nutrition to your dog's body, vitamins and minerals that they have perhaps been deficient in, really starting to get the gut health bacteria back in order, your dog's little body is going to detox. It's going to be a sort of this natural detox. So while that's happening, you don't want to throw anything else in it. You don't want to create, right? It's a type of stress, and we said we don't want to do vaccines under any type of stress. So get their health going. Then in about 3 weeks, with vaccine time, we're gonna, I'm backing up. Nutrition, antioxidant support, which is part of that detox. I will use things like green supplements, like to get things like spirulina and seaweed or kelp or a lot of that greenery. Think fresh leafy greens, and there are supplements that help us do that. I use vitamin C a lot, and we covered the probiotic and we covered the digestive enzyme. So that's the weeks prior. Day of, they're going to get all of that. They're going to get the thuya that we've been talking about, and dosing is different for the dogs, right? This becomes a consultation that we need to have. They will get essential oils on the injection site to help calm the inflammation that's associated with that. If we are getting the rabies vaccine, there is an additional homeopathic remedy called Lyssin, Lyssin, that I want to have in my pocket. I might not need to use it unless I have a dog that reacts, but I want it available immediately if I need it. I don't want to have to order it. And I keep that on hand. I will then get in a regimen for the next 21 days that continues all that nutrition. We also look at how we support the liver now with liver supplements. We use a detoxifying digestive enzyme, so I swap them out to one that is really more detoxification. I use the raindrop technique, which is a combination of essential oils, and I'll do that the day of the vaccine, and then a couple days later. For the first week, I'll do it maybe 2 or 3 times, and then I do it once a week for the next month. So that's immunity, antioxidants, homeopathy, essential oils, detoxification is all part of what we're trying to do in there. Am I getting the dog, am I getting that vaccine out of the dog? No, that's not what it's about. But it's about helping to support the body, the liver, the kidneys, the cells of the body, the immune system, the gut health, and keeping that little body as strong as it can be while it's having to deal with the effects of the vaccine, quote unquote, toxins that had to be administered, right? So the point of all of this is I want you to reduce the load everywhere you can. And if that means titering your pet to determine whether he needs the next vaccine or not, do it. There are affordable ways to do it. If you are questioning unexplained or even looking at conditions that your pet has today and you're thinking, he's a mess, right? Or his behavior's a problem, or his digestive health is off, or he's got an autoimmune disorder, or he's got chronic allergies, or whatever those things may be, it is worth taking a step and looking into, is there something in this path of homeopathy, essential oils, detox, nutrition that we can do that put him on a better path to health and well-being, and a reduction of maybe even an elimination of some of these conditions that some might call symptoms of, vaccinosis. It is worth evaluating. It is worth trying and putting your money, your investment money, into wellness rather than into trying just time after time after time of things that you may not be seeing enough improvement or enough sort of getting at the root of the issue. So reduce where you can, support every time. Every day is ideal, but certainly at vaccine time, we need to support before, day of, and after. And then if you have to go back to what your normal is for a little while, even if it's for budget reasons, so be it. At least you're doing what you can when you can, to try and get those things under control. But I will tell you, you will most likely find that if you just put your time and attention into wellness, your spending will be offset, and the health of your animal and his behavior and his just overall well-being is going to be far better for it. So I've kind of covered a whole bunch, but if I can help you, I'm happy to have this conversation one-on-one in a consultation as you are preparing for vaccines for your pet. Or if you're in a situation you're like, I think this may be related. My dog has issues that we can't solve, we can't explain, we don't understand, and you want to at least try to look at the nutrition, the antioxidants, the supportive care side of trying to find resolution. So I look forward to hearing from some of you. If you have any questions, let me know.